Biochemistry, Cellular, Part 2. Collagen. Collagen is the most abundant protein in the human body. Collagen is extensively modified by post-translational modification. Collagen organizes and strengthens extracellular matrix. Types 1 to 4 collagen are the most common types in humans. Type 1 in skeleton, Type 2 in cartilage, Type 3 in arteries, and Type 4 in basement membrane. Scab. Type 1 collagen is the most common type, which comprises 90% of collagen. Type 1 collagen in bone, made by osteoblasts, skin, tendon, dentin, fascia, cornea, and late wound repair. Type 1 in bone and tendon. Decreased type 1 collagen production in osteogenesis imperfecta, type 1. Type 2 collagen in cartilage, including hyaline, vitreous body, and nucleus pulposus. Type 2 in cartilage. Type 3 collagen. Reticulin is a type of fiber in connective tissue composed of type 3 collagens secreted by reticular cells. Type 3 collagen in skin, blood vessels, uterus, fetal tissue, and early wound repair. Deficient type 3 collagen in vascular type of Ehlers-Danlos syndrome. Myofibroblasts are responsible for secretion, proliferative stage, and wound contraction. Type 4 collagen. Type 4 collagen in basement membrane, basal lamina, glomerulus, cochlea, and lens. Type 4 collagen is under the floor. Basement membrane. Defective type 4 collagen in Alport syndrome, and type 4 collagen is targeted by autoantibodies in Goodpasture syndrome. Collagen synthesis and structure. 1. Synthesis, translation of collagen alpha chains, pre-pro collagen, usually glycine XY. X is often proline or lysine and Y is often hydroxyproline or hydroxylysine. Collagen is 1/3 glycine. Glycine content of collagen is less variable than that of lysine and proline. 2. Hydroxylation. Hydroxylation of specific proline and lysine residues requires vitamin C. Deficiency of vitamin C leads to scurvy. 3. Glycosylation. Glycosylation of pro-alpha chain hydroxylysine residues and formation of procollagen via hydrogen and disulfide bonds. Triple helix of 3 collagen alpha chains. Problems with forming triple helix leads to osteogenesis imperfecta. 4. Excitosis. Excitosis of procollagen into extracellular space. 5. Proteolytic processing. Cleavage of disulfide-rich terminal regions of procollagen leads to insoluble tropocollagen. 6. Assembly and alignment. Collagen assembles in fibrils and aligns for cross-linking. 7. Cross-linking. Reinforcement of staggered tropocollagen molecules by covalent lysine-hydroxylysine cross-linkage to make collagen fibers. Formation of cross-links by copper-containing lysyl oxidase. Cross-linking of collagen increased with age. Problems with cross-linking leads to Menkes disease. Osteogenesis imperfecta. Osteogenesis imperfecta is an upper extremity genetic bone disorder, brittle bone disease, caused by a variety of gene defects, most commonly COL1A1 and COL1A2. Most common form is autosomal dominant with decreased production of otherwise normal type 1 collagen with altered triple helix formation. Manifestations of osteogenesis imperfecta include multiple fractures and bone deformities after minimal trauma, for example during birth. Blue sclerae due to thin translucent scleral collagen revealing choroidal veins. Some forms have tooth abnormalities, including opalescent teeth that wear easily due to lack of dentin, dentinogenesis imperfecta. Hearing loss, abnormal ossicles. Osteogenesis imperfecta may be confused with child abuse. Treat with bisphosphonates to decrease fracture risk. Patients can't bite. Bones with multiple fractures. Eye with blue sclerae. Teeth with dental imperfections. Ear with hearing loss. Ehlers-Danlos syndrome. Faulty collagen synthesis causes skin to be hyperextensible and often thin or transparent, joints to be hypermobile and tendency to bleed, easy bruising. Multiple types, inheritance and severity vary, can be autosomal dominant or recessive, may be associated with joint dislocation, bari and aortic aneurysms, and organ rupture. Hypermobility type, joint instability, it is the most common type. Classical type, joint and skin symptoms, caused by a mutation in type 5 collagen, for example, COL5A1, COL5A2. Vascular type, fragile tissues including vessels, aorta, muscles, and organs that are prone to rupture, for example, gravid uterus. Mutations in type 3 procollagen, for example, COL3A1. Ehlers-Danlos syndrome can be caused by procollagen peptidase deficiency. Menkes disease. Menkes disease is a X-linked recessive connective tissue disease caused by impaired copper absorption and transport due to defective Menkes protein, ATP7A, absent copper, versus ATP7B in Wilson disease. Copper buildup. It leads to decreased activity of lysyl oxidase. Copper is a necessary cofactor and effective collagen cross-linking. This results in brittle, kinky hair, growth and developmental delay, hypotonia, and increased risk of cerebral aneurysms. Elastin. Elastin is a stretchy protein within the skin, lungs, large arteries, elastic ligaments, vocal cords, epiglottis, and ligamenta flava. Ligamenta flava connects vertebrae, which leads to relaxed and stretched conformations. Elastin is rich in non-hydroxylated proline, glycine, and lysine residues versus the hydroxylated residues of collagen. Elastin with fibrillin scaffolding. Cross-linking occurs extracellularly via lysyl oxidase and gives elastin its elastic properties. Broken down by elastase, which is normally inhibited by alpha-1 antitrypsin. Alpha-1 antitrypsin deficiency results in unopposed elastase activity, which can cause COPD. Marfan syndrome. Marfan syndrome is an autosomal dominant connective tissue disorder affecting skeleton, heart, and eyes. Marfan syndrome is autosomal dominant with variable expression and symptoms due to pleiotropy. FBN1 gene mutation on chromosome 15 results in defective fibrillin 1, a glycoprotein that forms a sheath around elastin and sequesters transforming growth factor beta. Findings of Marfan syndrome: tall with long extremities, chest wall deformity, pectus carinatum, pigeon chest or pectus excavatum, hypermobile joints, long tapering fingers and toes, arachnodactyly, cystic medial necrosis of aorta, aortic root aneurysm rupture or dissection. It is the most common cause of death, with mitral valve prolapse and increased risk of spontaneous pneumothorax. Homocystinuria. Homocystinuria is most commonly due to cystathionine synthase deficiency leading to homocysteine buildup. Presentation is similar to Marfan syndrome with pectus deformity, tall stature, increased arm-to-height ratio, decreased upper to lower body segment ratio, arachnodactyly, joint hyperlaxity, skin hyperelasticity, scoliosis, and fair complexion, versus Marfan syndrome. Marfan syndrome, autosomal dominant, with normal intelligence. Aortic root dilatation, lens dislocation is upward and temporal. Marfan fans out. Homocystinuria, autosomal recessive, with decreased intelligence. Vascular complication is thrombosis. Lens dislocation is downward and nasal.